Is your presentation up?
Yes, it is. All right, we're going to continue on this afternoon. I hope everyone had a good lunch. We're going to continue on with our regional presentations and spotlights, and starting off with the Asia region. So if they want to come on up and get started.
Can I have a clicker?
Yes, here you go.
Okay, great. This is going
Forward.
Okay. Okay, great. I think I will stand here so that we can interact better. So for the next 30 minutes, you're going to hear from us about FHI Clinical in Asia. And basically, you're going to hear us talking about the general background, and also by each country, you will hear where we are, who we are, what we have been doing, and also some future opportunities for development. Well, so if you look at the big map of FHI, you will see for FHI Clinical in Asia, currently we have our presence in China, Vietnam, and Thailand. We have our full-time working staff, like 4 in China, 2 in Thailand, and 2 in Vietnam. Although the team is not big, we do cover a very wide range of therapeutic areas, including like infectious diseases, TB, malaria, HIV, hepatitis, etc., and also cancer. So just a quick quiz after lunch. So on the left row, you see those are territory and also total population, some numbers. And on the right, those are the 3 countries. Can you just, do a quick match of the answers to those countries? I mean, China is simple, right? We have a very big territory and also population. So, of course, for China, I think the answer is A for territory, and also which one is for E, right? Our population is around 1.4 billion. And for Thailand, F is population. And how about the territory? Right. So Thailand is bigger than Vietnam, but has a smaller population than Vietnam. So for Thailand, that's C for territory, and also like F for population. And then you guys are very smart. Okay. Let's now dip into China. Let's see first. Okay, it's freezing. Okay, where we are. So just a brief overview of China, but I think most of you know we're in East Asia, and we have a very big population. We're very diverse. We have 56 ethnic groups. So in terms of total GDP, actually China now is the 2nd largest economy worldwide. And of course, the first is the US. But if you look at the GDP per capita, still China is is marked as a middle income country. And we are very proud of our culture. We are one of the 4 earliest civilizations with over 5,000 years of history and 24 dynasties. And you should just come to visit China. There are lots of places of interest, and I won't go into details today, but I want to mention our famous Chinese philosopher, the Confucius. So if you want to know Chinese culture, you should read the Confucius. And basically, the Confucianism emphasized personal and governmental morality, regardless of social relationships, justice, and sincerity. I think this is the base, of the foundation of our Chinese values. This question is quite simple. Which one is the most important festival in China? So, of course, we have our Spring Festival. So when families get together and we're going to do play fireworks, the red lantern, etc. So it's a very big thing in China. Well, so that's some background, and let's see who we are, our team. This is a lovely photo we took when Ted and Kim visited us this April in Beijing. So from left to right, you will see Xiaoting, who is actually leading the ASCOT study implementation in China, but it's a pity that she cannot come today. And then this is Fanny, who is sitting over there. So Fanny has done fabulous work on CTCDC project over the past 5 years since 2013. And Ted, of course, and Kim, this is me, and that's Dan Qing sitting over there, who has been provided very strong support to the operations of Beijing office. So we have a very lovely team. Let's see what we have been doing. So here is a list of projects ongoing and also completed, just to show you, what we have been doing over the past few years since 2013. So our flagship project is called CTCTC. It's China TB Clinical Trial Consortium, funded by NIAID NIH, aims to establish a high-quality TB clinical trial network in China. I will be introducing the details in slides later. Then ASCOT is funded by National Cancer Center Singapore, and basically looks at the effect of aspirin for colon cancers. This project is very long. I think that's the longest trial we have been running. And basically now our contract is until 2022, and the whole project is until 2025, so probably a few years after that. And for NDIP, it's New Drug Introduction Project. That's not a clinical trial to say, but more like a study that aims to introduce bedaquiline, the new drug to cure MDR-TB, into China, and also to establish a system so that to instruct those hospitals and also physicians to use TB drugs rationally to avoid drug resistance. So we've been running this project for 1.5 years, and we've completed that this June. Also, we have done a lot to prepare the STREAM 2 trial. This is a trial for a standard treatment regimen of anti-TB drugs for MDR-TB patients. But it's just due to some, regulatory hurdles, it fails to be introduced in China. But we did done a lot, and also, learn a lot from this. Let's look at the geographic coverage of our projects. So the first map shows our CTCDC network. So basically, currently we have 24 TB hospitals in this network, and you will see it covers east, central, and also west part of China. This is ASCOT. We have 10 hospitals in 5 provinces, and this is basically along the east coast of part of China. Just as you see, China, we have very serious regional disparities in terms of health. So east part of China is the wealthiest, and west part of China is pretty underdeveloped. And also NDIP, we have 35 hospitals and covering all the mainland China provinces except for Hong Kong and Macau. We do have very important key partners. We have here CCTB, National Clinical Center on Tuberculosis, China CDC, Beijing Chest Hospital, IATB. Those three actually are working as one unit because they share the same leadership. So we have established very good and trusted relationship with them through the CTCDC study. Of course, with our member hospitals of CTCDC, ASCOT, and NDIP study hospitals, and also our founders like NIH, Janssen, National Cancer Center Singapore, and also Gates Foundation. We are finalizing a contract with Gates, and I will also introduce that later. So our achievements. So as I said, CTCDC is our flagship project. So CTCDC, well, yeah, we want to build. Our role in this project is we are providing technical support to build this network and provide capacity trainings because there's still a large capacity gap. So our work has been focusing on those six main areas. Like we work to strengthen the network leadership. We did site assessment, site capacity assessments. Already we have done 4 rounds of such assessments. We have done a lot of capacity building trainings. I think a lot of you sitting over here have helped us, including like Peggy, Cornelia, and a lot. I think thanks so much for you guys for your support. And we also have a TB Lab Quality Control EQA program. We establish expert and working support groups, and also we help them to establish some international clinical operation standards. So because of our excellent work, our Beijing team has been awarded twice by the Chinese Medical Association TB branch, the International Cooperation Award for China TB Control. So that's a very recognition of what we have done. And also because of this, thank you. And also because of this, we have really established very good, strategic collaboration with our partners and founders. And the founder here. Okay, so next is I also want to talk something about the ASCO study. So it's a very long, duration in clinical trial, and it aims. Our role is more like provide site management for this study, which is to define the role of aspirin as an adjuvant agent in patient colon cancer. So. The sponsor, National Cancer Center Singapore, is very complimentary of what we have done. And also Ted visited them. I think they had a very conversation about our work. And also because of this, this good relationship and good work, we do, have been approached, for example, by the local sites to say, well, we want to, continue to work with you. Can you continue to provide services for us like that? So I think this is really something, recognize our work. Okay, I won't go to details. So future opportunities, I just want to spend maybe a few minutes talking about this. So just to summarize, because of our working, our projects over the past few years, so we summarize that we have 3 most important assets. We have very strong work foundation with key TB stakeholders. So those are like Beijing Chest Hospital, CCTB, IATB, they are pretty much the leading TB hospital in China, and because they also play, the role to provide technical support for China CDC and also Ministry of Health. So they've really got very good resources and connections. Gates Beijing office, of course, and also CDC and NDIP hospitals. And second, we think we've got we're very well recognized by our local partners. And third is we we do have very good access to TB and also cancer clinical trial sites and patients. So in terms of TB, now we have, as I mentioned earlier, we are working with Gates to finalize a contract to help with their global TB strategy. So this basically our role is to help Gates to identify new TB drug candidates that can be developed into new regimens and then to be tested in clinical trials. So that we do think this is a very inspiring piece of work, and glad that we'll be part of that. For cancer, for the cancer related, so we, as I said, we have been approached by the physicians in those sites and to say, well, we want to work with you. Can you just provide such services to us like that? And we have been working closely with them. Oh, I forget to mention also one more opportunity that BD opportunity we're working on is with Janssen China, and Janssen basically pharmaceuticals is Johnson & Johnson, and also with CCTB, it's a short course MDR-TB clinical trial. So now we're working on the budget, and hopefully this trial will start early next year. So I think that's about China. So we wish FHL Clinical good fortune, big success. Those are some, some graph we will do at the Spring Festival. So thank you so much. I think next I will welcome Amy to introduce about our work in Thailand.
Thank you. Yes, as the name, Land of Smile. And it's the way to say Sawadika. You can use even the good morning, good afternoon, good evening, every time you can like a Sawadika. Yeah, ka is for girl and for boy is club. And it's the polite way to say Sawadi. And normally for the younger, always we call why to say you respect for the elder. Okay, so where we are, I think everyone know, and maybe more than, about 30% in the room ever visit Thailand. So why I use the color? This is the Thailand flag, and each color have the meaning, because our country, we have our beloved king, the late king, and also we are respect in, like the religion. The main is Buddhist, but we are happy and we support together whatever your religion. It is the red one is mean for the Lord. Sorry, I'm just dark and forget the English how to say. It's like for the country, for the red one. And for Thai, we proud that we never colonized by other country. And for the white one, it means for the religion. Not only the Buddha, but it means also Christian, Muslim, every. And the biggest one, the blue one, is for the loyal, majestic. Okay? And I think I will skip this because everyone already know and you can Google. It's easy. And it is the Thai culture. At first, I planned to wear the Thai dress, but sorry for myself, I'm a bit bigger, so I can put it. Yeah, so I decided to wear this. This is in Thai we call it's like a salon, everyone, but use the Thai fabric and just made it in modern style. And you can see, and because of the Thai style dress, sometimes it's not easy like a casual. Even you said the theme for this meeting is the casual business, but sometimes it may be a bit too much. So, but it's a nice dress, right? And then, what thing you know about Thai, as you know, for Thai, family is a matter. So, for me, if you remember my happiness. My hobby is making my family happy. This is one of my goal. And also the status is important. As I told you, like for the younger, should pay the respect to the elder. And in Thai, you cannot call by name. You cannot call like a name, just only your friend. But if elder or younger, we have a pronoun to use. If you just call name, oh, it's not good. Some of you, what? I'm not your friend, something like that. And the religion in Thai is unique, and the main one is Buddhist. And as I told you, I love to do the meditation. And now in US, I think the meditation also famous. Even the Google team, they allow to do the meditation. So meditation is not only for the religion, it's about to mindfulness, peaceful and enlighten your mind. Okay, I think that's all you can see from my presentation. I like to skip it because I want to save the time, okay? And this is the Thai culture and Thai food. And this one is the famous one, Tom Yam Goong, yes. And I'm so sorry that this time I have very short time for prepare myself. At first, I plan to bring some ready-made for Tom Yam. So next year, give me a chance to visit here again. I promise I will bring it for all of you. Okay, and now who we are. We ever have a big team in Thai, if you remember, more than about decades. But right now, we still great, even we have two, Arwan and I. And what we are doing now, right now, we have a main study right now, only the C-free study. And it is sponsored by Linkages. And Linkages may be funding from the USAID. Yeah. And for Arwan and I, provide site management as a monitor for this study. And another study is about the ASCAL. Mainly, we conduct in China, but for me, I'm a PM for this study. And for this, I would like to emphasize again, and thanks to Xiao Ting, who did not join us for this time. Because of her work hard and will contribute, we got a great appreciation from the sponsor. And we support the sponsor, not only the thing in our scope of work, we try to help them in another thing. For example, the two main things is really impact. The first one is we're facing with the role recruitment. The recruitment rate is too slow, and it seems like the current site cannot enroll more. And because of Xiao Ting has a good connection with the hospital, she proposed to me, is it okay, Amy, if we propose to the sponsor to add some more site? And then when they get to the sponsor, they are happy. And Xiao Ting helped us to seeking the potential site and propose to the sponsor. And yes, we have 3 more sites. And right now, we are the number 1 from 11 countries. For 11 countries that have the highest number of the enrollment. And the second thing is, when the sponsor plan to have a China site investigator meeting, but they have a very, very limited budget. It is a bit, the fact is because the study is conducted in 2011 or maybe 2010. Even the sponsor of the sponsor think it's too long, so their own was cut, for that, their funding. So Xiao Ting helped again to communicate with the PI, because at that time, in March this year, at the site in southern of China, gonna have like a, not sure, it's not like a country, it's like a regional meeting for the oncologists. And because of our support from Xiao Ting and negotiate with the PI negotiate with the funder, not the funder, the government or maybe the hospital, and then they just extend the meeting for have the meeting only for our study. So without our support from FHI Clinical, I believe that those of two things not happen at all. Yeah. So the thing that we have done, we have as you may know that we have a great time. We ever done for the about 5 study of the malaria study and also the infectious disease. At that time we worked with the SEA-ICRN network for the study, and also we work with the cooperate with the Thai US CDC. Okay, it's called for short CDC. Yeah, for the HIV prevention. Yeah, that's all. And the main thing right now, we as R1 and I are certified trainer for the GCP. So we are around in Thailand, and also we extend our support to Cambodia team for provide the GCP training to them. Oh, and one more thing from me, I would like to say thank you very much for Africa team to choose me to be one of you. Thank you so much. and also give me a good chance to find my sister from other country. Okay, and so for the future, I think we can do the study more in Thai. For the vaccine, we still have the Queen Sirikit National Institute of the Child Health and also the Thai Red Cross. And for the infectious disease, we have like a for malaria with the hospital for tropical disease, TB and moderated resistant TB at the Sirat Hospital, also HIV/AIDS, hepatitis B and hepatitis C as well, and also for the parasite infection and oncology. Yeah. And also this is the type of the oncology, and this is our partner in the past and also in the current. In the past, we ever served for the MMV and also for SEA-ICRN, and this one is the new CRO in Thai, and we work for the C-Free study, Dream Development. Yep. And for Novartis, I believe that now everything changed when we changed from FHI 360 to FHI Clinical. And in the past, we have a good relationship with the Novartis team to work with us. So I believe that we still have a good connection. Okay, I think that's all from me, and then move to Vietnam. Thank you so much.
Thank you very much. Hi, xin chào. Normally in Vietnam, that when we meet each other and then we greet each other, we say xin chào. So we see in that one. So, okay. So it look like in Thailand, sawadee krap, sawadee ka. So sometimes in Vietnam we use xin chào. Okay. That is every time we maybe visit Vietnam in the future, so we can use that word. Okay. So where we are now. So Vietnam is located in Southeast Asia. So we are border with China, Laos, Cambodia, and the east part. Then we have the DC. And I'm not going to read all of this data on the slide. So we just know that currently we have the population right increase 97 million already. So. And geography that we have divided in 4 regions that we have in the north, the south, and also in the central, what we call highland, where I was born there yesterday. I just mentioned with you in the highland. That's area that we have a lot of malaria on that. But right now that is very diverse there. So, okay. So in culture in Vietnam, that we also have 3. For religion, that we have 3 religions main in Vietnam. That is one is Buddhism and Confucianism and Taoism. If you see that this one pillar pagoda in Hanoi, that is a symbol of Vietnamese culture, as you might see in the picture. And also some for this festival like in Hue, Tet holidays, you might heard that word in the future. I'm not going to explain this one, I just try to introduce to you that the culture in Vietnam. And also in the south, the most famous crowded city, that is Ho Chi Minh City. I think Peggy know this because you there, okay? And also for traditional clothes that you may know this ao dai, very beautiful for the woman, actually. Yeah, sometimes make sure that wear this kind of ao dai should we have clothes. Otherwise, just a joke on this one. Many people that you say, when wear ao dai, do we need to wear clothes under? Yes, of course. Okay, and also very famous food that I think in US you know this kind of dishes, right? What is that? Pho. Okay, so everyone knows, right? I heard that people didn't know this kind of pho. Okay. Okay, I'm not going to quiz again because you know already, right? Because in Vietnam, even you stay in the north or in the south or in the middle part of country, but you can find pho easily. But some part that you could not find something like mi quang. Mi quang just only in the middle of country, but like a meat or noodles just only in the Mekong Tata rivers. So you can have this. That is typical different, and also the first one is represent all the area in the country. Okay. So we also have the traditional music. Normally this one is very difficult to explain, but I just showed you to see the pictures only. Okay. But in the southern part, that normally they use a small bowl like this, and they do traditional instrument as well. Okay, so we are. So in Vietnam team that we just had 2 persons actually. Dr. I that unfortunately that he could not make this trip, and we joined FHI almost more than 10 years already, since FHI 360. And what we're doing now. So in Vietnam, we have currently 2 trial on vaccine. One is pneumococcal conjugate vaccine study, what we call PCV study, that is supported by Gates Foundation through Nagasaki University of Japan. And investigator is National Institute of what we call it NIHE in Hanoi. This organization is very experienced on conduct study on vaccine actually. And what FHI role here is to provide monitoring service. And this study try to investigate the existing and also the future PCV schedule to protect the community in a resource limited setting with the lower cost and also a fewer dose. They try to see which schedule is better that for the national program in the future, whether we have 1 dose, 2 dose, 3 dose. And this study is still going on. Our population is for the child only. There was designed 3 arms. One is for catch-up vaccination that this arm already finished, and also the second arm is they introduce the PCV in the communities for routine vaccination together with the international programs. This is conducted in Nha Trang City with the 27 site that is commune level. I think Peggy already been there. This one, so see now. So what is sorry? So this progress study, the first arm already complete for enrollment, and the second arm and the third arm will be finished in 2020. Okay, so the second vaccine study that is called Vietnam Pneumococcal Trial 2. Actually, this one, the simplified vaccine use herd immunity approach. And this one we use 2 PCV, that is PCV10, that's what we call it Synflorix, I think in commercial name, and also another one is Prevena, that is PCV13. This one also ongoing study in Ho Chi Minh City. That's Dr. I monitoring this study, and that's supported by Murdoch children from Australia. Okay, so again, FHI also provide monitoring service only. So This study has been complete. Enrollment is more than 2,500 children, and still follow up around 2,000 more. And we will complete in 2020 as well. So we only have currently just 2 projects. So after that, we don't know yet in the future. So that is what we're doing now. So what did we do in the past? Because I would like to list this so you know that Vietnam in the past, we also conduct several studies. And then what is short period, and then the study has been closed, you know. There are a lot of study last time. Just like we have conducted a study on phase 2, phase 3 in influenza for vaccine H5N1. That is support, sponsored by WHO and part. This study is complete. And also we have 3 study on malaria that what compound of KAE 156 and another KAE 609. Also, at the same time, with Thailand, conduct this one in 2014. That's sponsored by Novartis. So I'm very happy that George just mentioned earlier this morning that actually Vietnam we did conduct this compound already, but last time we used oral dose for the adult, not for the children. So we have the side on this one, and we also have dengue fever study in the past that was supported by Roche, and also we have oseltamivir for influenza treatment again, and also we have TB study, and we have also cancer study. That one is rectal cancer study in Ho Chi Minh City, and also vaccine that is supported by Merck. So at least that we have exposed to many sponsor in the past, but right now we don't see this sponsor again, like Novartis, Roche, also NIH, Merck. So I would like to list this. It means that if you're now also involved in many study in the past, but right now we are not have this kind of sponsor go back. Okay, so what is the future? As Thailand mentioned, that we also right now we see that most potential in Vietnam, that we try to conduct some study that related to vaccine, also infectious disease that include malaria, TB and dengue fever, and also HIV/AIDS, Hep B, Hep C. That we can, because we have very good organization that they're capable, that they're very experienced on conducting this study. And also at the same time we have subject to enroll, as long as the organization that know the interest of sponsor that related to this area, that Vietnam can be considered in the list to participate in the study in the future. Hopefully that we can involve on this one as well. So I think that's it. But this one also have something, but no one to explain more. So that's it all. Thank you.
Do we have any questions for the Asia team? Claudia? I don't think so. Melinda? Do we have a name? Oh, we do.
So we're, as all you know, we're currently under registration for FHI Clinical in China. We have a Chinese name, and this is created by our team actually here sitting there. We have Fanny and also Shouting, and we've thought a lot, and then we proposed a few, and then selected. It's in Chinese is Jia Kang Li. So Jia means basically well, good. Kang is health, and Li is more like growth. So we think this is a very good name for FHI Clinical, who is our startup phase, but aim to work on health, and we want good growth. So that's the name for FHI Clinical in China, Jia Kang Li. Yeah, that's right.
I just had a question for you, Dr. Bro, about the first pneumococcal study, the one with 27 communes. So are you and Dr. I having to go to all of those 27 communes as you monitor, or only to central sites?
Okay, that's a great question. Thank you very much, Colinia. Actually, this is in the commune level. That is 27 commune involved in the study. When we do the monitoring, that we just do at the provincial health service only. We cannot go to each site with all of document that they bring to the provincial health service, because you know the NIHE in Hanoi and the NIHE in Hanoi and the contract with the provincial health service and provincial health service, and then they have a team in the commune, 27 commune. So we are not going to the site. But all of the study document they bring to the provincial health service. They mean at the provincial level. Am I answered your question? Okay.
Is the food something you can put in the mail, Amy?
Okay, I think I can. Yes. No. I remember even we spin off from FHI 360, but we still have FHI Pulse something that like around, yeah, in the Pulse. So I can, when I'm back to Bangkok, I can send it for sure. Don't worry.
Okay, so up next, not last but not least, is the Americas. Blanca?